Here's a surprising fact. About 1 in 5 adults experiences a mental disorder each year. Could you spot the signs when they appear? Let's find out. In this video, you'll learn what abnormal psychology studies, how experts decide when behavior crosses the line, 2 major theories on why it happens, and a snapshot of the most common disorders. Let's start with a definition. Abnormal psychology is the science of unusual thoughts, feelings, and behaviors, especially those that cause distress, dysfunction, or danger. To help identify these patterns, clinicians rely on the 4 Ds of abnormality, namely deviance, distress, dysfunction, and danger. Now, when it comes to explaining mental disorders, there are 2 major perspectives. The somatogenic perspective points to biological causes, genes, neurochemistry, even infections. For example, schizophrenia's link to dopamine is a textbook case. Backing this up, twin studies show that identical twins share up to 50% risk for major depression, suggesting genes set the stage while environment pulls the trigger. Meanwhile, the psychogenic perspective focuses on psychological roots, such as trauma, distorted thinking, or unconscious conflict. From early psychoanalysis to modern cognitive behavioral therapy, or CBT. Psychogenic theories ask, what thought patterns keep the problem going, and how can we change them? Today, most clinicians blend both views using a biopsychosocial model. That means combining medication with therapy to tailor treatment to the whole person. To diagnose, professionals use clinical interviews, standardized tests like the 3rd edition of the Minnesota Multiphasic Personality Inventory, or MMPI-3, and structured observation to create an evidence-based plan. Together, these steps help pinpoint what's happening and shape a tailored treatment approach. Ready to lock it in? Tap the link for study guides and flashcards on this topic so you can keep learning without missing a beat. Now, let's explore some of the most commonly discussed diagnoses in abnormal psychology. To start, anxiety disorders, including generalized anxiety disorder, phobias, and panic disorder, involve persistent fear and intense physical arousal. Next, mood disorders disrupt emotional regulation. For example, major depression drags mood down, while bipolar disorder causes swings between depressive lows and manic highs. Moving on to psychotic disorders, conditions like schizophrenia involve symptoms such as delusions, firm false beliefs, and hallucinations, which are often auditory. Then, there are personality disorders, which show up as long-standing patterns that interfere with work, relationships, and everyday functioning. To bring structure to this complexity, the Diagnostic and Statistical Manual of Mental Disorders 5, or DSM-5, classifies mental disorders, helping clinicians, researchers, and insurers make sense of diagnoses and guide treatment. But this isn't just labeling. It helps direct people to the right kind of help faster. When it comes to treatment, options range from elective serotonin reuptake inhibitors, or SSRIs, and antipsychotics to CBT, dialectical behavior therapy, or DBT, and community programs. Treatment is personalized, starting with the least intensive option and stepping up only when necessary. To recap, abnormal psychology defines, explains, and treats behaviors that deviate, distress, or impair. It draws on both brain science and psychological theory to help people manage anxiety, mood, psychotic, and personality disorders. Ready to quiz yourself with the content covered in this video? Check out the link in the description where you'll find Quizlet content made just for you.